Dr. Silverstein.
Hi.
Hello.
How are you?
Good, how are you?
Good. I'm student Dr. Hadamiya. And your name is?
Alvin.
Alvin. Is it okay if I call you Alvin?
Sure.
Nice to meet you, Alvin. Okay, Alvin. So what brings you in today?
Just here for my annual physical.
For your annual physical. And when was your last physical?
About a year ago.
Okay. And were there any findings with the last physical?
No.
No. Okay. And has anything changed since then?
No.
No? Okay. And so aside from your annual physical, is there anything else that you want to talk about today?
Not really.
Not really. Okay. Great. So what I'm going to do is I'm just going to start with some general questions, okay? So do you have any allergies?
I'm allergic to peanuts.
Ooh, okay. Peanut allergy. What happens when you have peanuts?
Break out in hives?
All right. Any other food allergies?
No.
Any other allergies? Contact, environmental?
No.
No? Medication allergies?
No.
Good. And are you currently taking any medications?
Yes.
Okay. What do you take?
I'm on simvastatin.
Simvastatin. Okay. And then what is that for?
High cholesterol.
All right. And what dose do you take? Do you know?
10 milligrams.
10 milligrams. How frequently?
Every day at night.
Every day at night. Okay. And is that orally or?
Yeah.
Okay. And aside from the simvastatin, any other medications?
No.
Any supplements?
Multivitamin.
Multivitamin. Okay. And that's just a daily multivitamin.
Yeah.
Take that orally as well.
Mm-hmm.
Okay. All right. And any past medical history?
I have high cholesterol.
High cholesterol. Okay. And when were you diagnosed with that?
About 8 years ago.
8 years ago. Okay. And 8 years ago, could I get your age?
28.
28. Great. And so you were diagnosed with high cholesterol 8 years ago, and you take the simvastatin for that?
Mm-hmm.
Okay. And it's controlled pretty well with that?
Yeah.
Great. Any other past medical history issues?
No.
No. Okay. And any surgeries?
I had my appendix removed.
Okay. And when was that?
That was about 10 years ago.
10 years ago. Because of appendicitis?
Mm-hmm.
Okay. And any complications with that?
No.
No. Great. And any other surgeries or hospitalizations?
Not that I can remember.
Okay. And how's your family doing? How's their health?
My mom is healthy.
Okay.
She's 55 years old. My dad has high cholesterol and hypertension.
Okay. And when was he diagnosed with those?
For the high cholesterol, he was diagnosed at age 30.
30, okay.
And then for the hypertension, I believe it was about 7 years ago.
Okay. And how old is he now?
He's 55.
Okay. And any siblings?
2 younger brothers.
Okay. How old are they?
27 and 21.
Okay. And how are they doing?
They're doing good. They're healthy, except my 27-year-old brother has
Mhm.
high cholesterol.
Okay. And when was he diagnosed with that?
I think about 3 years ago.
3 years ago. All right. Sounds like high cholesterol kind of runs in the
Yeah.
family, huh? Now I'm going to ask some questions about your social history, if that's okay.
Okay.
First, why don't you tell me about any tobacco use?
No.
No. And in the past at all?
No.
No. Great. Any alcohol use?
Occasional.
Occasional? How frequently?
2-3 times.
2-3 times
Kind of like on some weekends.
on some weekends. Okay. And what do you like to drink?
I like to drink whiskey.
Whiskey? Okay.
Mm.
And how much?
Just like a couple shots
Okay.
mixed with Cokes.
So like cocktails?
Yeah.
Or, okay. Any recreational drug use?
No.
No. Great. And how's your diet?
Try to eat healthy.
Okay. Why don't you tell me what you normally eat?
Try to eat salads for lunch. Dinner, I try to eat like Chipotle or I don't know. It kind of varies depending on my work.
So do you cook most of the time at home, or I know you said Chipotle? Do you eat
Couple
out
days
lot?
a week.
Couple days a week? Okay. Sounds like you're eating pretty healthy though.
I try.
Yeah. And any exercise?
Yeah. I exercise like I think 3 times a week.
Okay. What do you like to do?
I like to do a little bit of cardio and then hit the weights.
Okay. That's great. Sounds like you're exercising quite a bit. And what do you do for a living?
I am a 4th grade teacher.
4th grade,
Mhm.
okay. 4th grade, so that was like all about the gold rush and everything.
Yeah.
Yeah. The missions, they
Yeah,
still build the
definitely.
little models.
Yep.
I remember that. Fun times. Okay, and other than being a teacher, what other hobbies do you have?
I like football.
Football, okay.
Mhm.
Do you have a favorite team?
I like the San Diego Chargers.
Okay, the Chargers. Hopefully they'll be okay this season.
I hope so.
Yeah, we'll see. Philip Rivers is pretty good. So, football and anything else?
I enjoy music.
Music.
Mm.
All right, and what's your living situation?
Live with a roommate.
Roommate, okay. And an apartment, house?
An apartment.
Okay. And any pets?
I have a pet dog.
What kind of dog?
Golden Retriever.
Okay, I love Goldens. Yeah, I have one myself.
Cool.
All right, and then are you currently sexually active?
I am.
You are, okay. And are you sexually active with men, women, both?
Women?
Women. And how many sexual partners have you had in the past year?
One.
One. And any contraception use?
We use condoms.
Condoms? Okay, good. All right, so now that I've taken the history, I'm going to move on to the physical exam, if that's okay. All right. How's your head been?
It's been good.
Good. Is it okay if I touch your head?
Sure.
Any headaches?
A little bit.
Little. Okay. And any trauma to the head at all?
No.
Okay. I'm just looking for any lesions. Okay. So you said you have some headaches.
Yeah.
Next, I'm gonna look at your eyes. How's your eyes been?
It's been good.
Any blurry vision?
No.
Any visual loss?
No.
No? Okay. So I'm just going to shine this light. Go ahead and look straight over my shoulder. Okay. First, I'm just going to see if there's any reflexes. Good in there. Reactive. Check for what we call the red reflex. That's good. I'm going to get a little closer now, okay? Okay. Great. I'm going to look in your ears. How's your ears been?
I'm fine.
Any ringing?
No.
No? Any hearing loss?
No.
No? Okay. And then after this, I'm going to look in your nose. How's your nose been? Any discharge?
No.
Any congestion?
No.
No? Okay. Just take out this smoke. Yeah. You can just go ahead and go on. Okay. Go ahead and tilt your head back for me. I'm going to look in your nose. Sorry, this may tickle a little bit. Good. Great. And then last thing, if you could open your mouth and stick out your tongue and say ah. Good. And how's your mouth been?
It's fine.
Any bleeding gums?
No.
Cavities?
No.
Trouble swallowing?
No.
Okay. Next, I'm going to take a look at your neck. Okay. Any sore throats?
No.
Any masses or anything?
No.
No? Okay. Is it okay if I feel?
Sure.
Just let me know. First, I'm going to feel for your thyroid. Go ahead and swallow for me. Good. And I'm just going to inspect your neck, and everything looks okay. And is it okay if I feel for lymph nodes? Let me know if anything's tender or tenderness.
No.
No? Okay. I'm also going to feel your sinuses, if that's okay.
Okay.
I'm just going to palpate. Let me know if anything's tender up here.
No.
What about down here?
No.
No? Okay, I'm just going to percuss them. Any tenderness?
No. No.
Anything?
No.
Okay, great. Next I'm going to listen to your heart. Is that okay?
Okay.
Do you mind taking off your shirt for me? And any chest pain?
No.
Any palpitations like your heart's racing? No?
No.
Okay. Okay, good. I'm gonna listen to your lungs. Okay.
Okay.
How have your lungs been?
They've been fine.
Any shortness of breath?
No.
Wheezing?
No.
No. Okay. So when I place this on here, go ahead and take a deep breath in and out. Okay. Listen to the side. Good. Great. I'm going to do the same thing on the back, okay?
Okay.
So just take nice deep breaths. Great, and your lungs sound good both sides, no wheezing or anything. And I also looked at your skin and I don't see any lesions or anything like that. And you haven't had any dryness, right?
No.
And any rashes at all?
No.
Next I'm just going to percuss those areas, okay?
Okay.
Okay, great. Next, Alvin, I'm going to have you lay down. I'm going to take a look at your stomach, okay? We'll leave your shirt off, so go ahead and lie down for me. Okay, now I'm going to move on to the abdominal exam. Have you had any abdominal pain?
No.
No, any diarrhea?
No.
Nausea?
No.
Okay, good. First, I'm just going to inspect the area. I don't see any lesions. I don't see any distension either. Is it okay if I take a listen?
Okay.
Okay. So I'm just going to listen for bowel sounds. Good, and I heard active bowel sounds in all 4 quadrants. I'm also gonna percuss those areas, so is it okay if I tap?
Okay.
Okay. And the last thing I'm gonna do is palpate. Is it okay if I palpate?
Yeah.
Let me know if anything's tender. Any tenderness at all? No? Okay, great. Okay, Alvin, next I'm going to do the musculoskeletal and neuro exam, okay?
Okay.
Have you had any joint stiffness at all?
No.
Any joint pain?
A little bit in the
A
shoulder.
little bit in the shoulder? Okay. And what about any numbness?
No.
Any tingling?
No.
No. Okay. So the first thing I'm going to do is just kind of palpate those joints, okay?
Okay.
So I know you said this one was tender, so I'm just going to start on this side. How does that feel?
It's fine.
Fine. And on this side?
It's good.
It's good? Okay. Then the elbow. Any pain here?
No.
And then how about on the wrists?
No.
Okay. And the knees?
No.
No? What about in the foot?
No.
Okay. Next I'm just going to check your pulses, okay? So I'll check your radial pulse. Good, and that's strong and equal bilaterally. And the posterior tibial pulse. Same thing. Okay, next I'm going to check sensation. So I want you to close your eyes. And I want you to tell me if you're able to feel this on both sides and if they feel equal.
Yeah. Mm-hmm. Yes. 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 Yes.
Yep, okay, good. And then I'm also going to test, you can open your eyes, I'm going to test your muscle strength. So I want you to just bring your arms up and then let me push you down. Good. And then push down on my hands. Great. And then just go ahead and squeeze my fingers. Good. And then I want you to kick out. Good. And pull back. Good. And pull up. And press down. Great. And those felt strong and equal bilaterally. Next I'm going to check your reflexes, okay? So go ahead and just relax your arm. Good. Perfect. All right. And then next I'm just going to have you stand up. I'm going to look for any asymmetries. Is it okay if I palpate your shoulders?
Yeah.
Okay. And those those look pretty symmetric. And your hips is okay if I palpate that?
Yep.
So looking at your iliac crest. And those look equal. Alright. So last I'm going to ask you some silly questions, okay? Do you know your name?
Alvin.
Okay, and where are you?
Here at Western.
And why are you here?
Just getting a physical.
Physical, okay. And then do you know what day it is?
It's the 6th.
Yep, correct. Okay, next I'm going to have you walk back and forth with me, alright?
Okay.
So why don't you just walk that way normally? Good, and come back on your toes. Alright, and then walk back on your heels. Great, and then come back walking in a straight line, one in front of the other. Perfect. Good, and that concludes our neuro exam. You can have a seat. So I noticed though that you mentioned your dad had high blood pressure, so I'm just going to recheck your vitals if that's okay.
Okay.
Okay, so let me see your left arm. Okay. I'm just going to place this around there. How's that feel? Is that okay?
It's fine.
Okay. So just go ahead and relax your arm as best as you can. Great. Okay, and your blood pressure is actually really good. Good job. I think all that exercising is helping. Cool. Okay, and then the last thing I'm going to do is just check your pulse and then also look at your respiratory rate, okay?
Alright.
Just go ahead and relax. And just breathe normally. Alright, great. So that concludes our physical exam. I think everything looked pretty good. Do you have any questions or anything?
No, I didn't.
No? Okay, so what I'm going to do is just talk to our attending, but I think everything looks fine, and if there's any concern, then we'll give you a call and let you know. But other than that, you know, like I said, things are looking great. I think you're doing a good job, and we'll just see you back here in another year for your next physical.
Sounds good.
Okay, thanks for
Thank
coming
you.
in.